Hi, Rebecca.
Hi, how are you?
I'm good. How are you?
Good, thanks for having me.
Yeah, we're so excited you're here. So, one of the things that we'll do is we'll give everyone like a few minutes to join, and then I'm going to launch a poll. So, if you are already on the call, if you're on your phone or your computer, in the question section or the chat, let us know where you are dialed in from. We just kind of like love to know where everyone is. I'm in Austin, Texas. Rebecca, where are you again?
I'm in Boston, Massachusetts.
All right, Boston and Austin.
Yeah.
When do you guys expect your first snow?
Oh God, I don't know. We've only lived here a year, and last year there wasn't a lot of snow and it didn't start till like after Christmas maybe. So I'm
Where'd you
hoping it's a really mild winter. We came here from Los Angeles, so it was a big
go? Big change.
Mhm.
Amazing.
Yeah.
Okay, so if you guys have joined, let us know, please, where you are dialed in from. And I'm going to go ahead and launch this poll as well. This poll okay, we've got Westfield, New Jersey. Okay, I'm going to launch the poll. So if you guys will take it, this just helps Rebecca and I sort of like understand where everyone is in their life phase with parenting. So I'm going to launch it and I'll leave this up as people are joining. All right. Can you see the poll, Rebecca?
I can.
So far we've got 50% are expecting their first baby, and then it's split, 25 expecting second or third, and 25% are a new parent. If you are a new parent, please let us know how new, how old is your baby? And again, if you are joining us, please let us know in the chat where you are calling from or where you're dialed in from. Brooklyn, Portland, Maine, San Diego. All right, let me see if the poll has changed. Still the same. Half is expecting their first baby and then 25% second or third, 25% new parent. Let's see here. Let me go back to the questions. Okay. Richmond, Virginia, Houston, Texas, Rockville, Maryland, Jackson, Mississippi. Oh my gosh. Amazing. Okay, and then if you are the new mom that's on, let us know how new, and congratulations to all of you that are expecting either your first or your second or third. Okay, so Rebecca, I'm gonna leave the poll up for like one more minute and give everyone just a few more minutes to join and then we'll get started.
Okay. I can't see our video thing anymore. Is that because the poll's up?
Yeah. As soon as I end the poll, you'll see the video back up on the screen.
Got it.
Yeah. Okay, let's see. So to those that have joined, let us know where you are calling from, like where are you located, and then please go ahead and take the poll for us. That just helps us understand where everyone is in their parenting journey. All right, one more minute and we'll get started. So now it's kind of shifted, Rebecca. Half of the attendees are new parent and 38% is expecting their first and 13% is expecting their second or third.
Okay.
Congratulations to all of you. Let's see here. Okay, well, I think without further ado, we should just get started. So I'm going to close the poll. I can open it if there's time towards the end of this session. Okay, is your video back up? Okay, great. Well, thank you to everyone that is here today for this like really important discussion. If you saw my email to you about registering or my Instagram post, you know that this is like a topic that is really important and personal to me and something I wish I had access to when I was pregnant with my first. So I'm Sarah, the founder of Populist, a simplified baby registry platform. I have 2 daughters, Amelia is 4 and Zoe is 1. I live in Austin, Texas. And yeah, that's like just a small little bit about me. Rebecca, if you'll give us a quick intro, we can get started.
Sure. So my name is Dr. Rebecca Lesser-Allen. I am a clinical psychologist, and technically I'm based in Los Angeles, but I'm living right now in Boston. But my practice is based in LA. I do all telehealth, and I see people for individual therapy, adolescents, sort of about age 12 through adults. And I specialize primarily in seeing people navigating all aspects of parenthood. So people going through fertility challenges, in the process of conception, pregnant clients, people adjusting to new parenthood and the postpartum phase, and then also, navigating all later stages of parenting and dealing with, everything that comes with that. I'm primarily interested in helping people navigate sort of the transitions and changes in identity and sort of relationships that come with parenting. And I work with couples too, and then I also run something called Hold the Mother, which is a postpartum, I call it a self-exploration workshop. And it's a place where really, it's a designated group for navigating the transformation and sort of change in identity that happens in motherhood. So we really think about and talk about your birth experience, your identity, your partnership, your relationship with your body, your sexuality, your career, and your, history with your own mother and like your own childhood and how that impacts your journey as a parent.
Sounds like I could have used that and still can. Okay, well, thank you so much for that intro. So I just want to set the stage really quick for everyone that's on the call. I'll share a little bit about my personal experience, but any questions that you guys have during this entire discussion, please, 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 they'll remain anonymous. I won't say who's asking the question. Just type it. We will get it answered. If there is like a burning question that you just need answered before we get off this webinar, please don't hesitate to ask it. Other people who are on the webinar can't see who's asking the question. So please know this is just a really safe space for you guys to get the information that you need. When I first started, sending out comms about this webinar, I think it was the most, it's like the most registrations we've ever had for a webinar. I had so many DMs about people asking, is this a place where I can share my story? Or, oh my God, I'm so thankful someone's talking about this. And I think that is the point of this solicited advice series, is that we are trying to get the experts and people to talk about the things that we need to know, like the actual important things, not what diaper should I be using, but like, how does this transition really impact me? And what can I do if, I experience one of these perinatal mood disorders that we'll talk about. So just quickly, when my daughter Amelia, she's 4.5 now, she was born in May 2019. My postpartum depression didn't appear really until month 6 or 7. And I was commuting from Austin to San Antonio. She was at daycare when she was 3 months old. I was pumping on the road, pumping in a corporate environment, stressed, traveling for work with a newborn. And I just didn't know. I didn't see the symptoms in myself first, just like how deep I was in postpartum depression. Until I had just like a very scary moment on, if you're familiar with Texas, there's someone here from Houston, driving on Interstate 35 from Austin to San Antonio. I was in my car, and this is a very short story, just trying to summarize it quickly for everyone. The first moment I realized in myself that I needed help was when I was sitting in my car in traffic driving from Austin to San Antonio, and I thought to myself, what would happen if I just hit this car in front of me? And there was no part of me that wanted to die. I had a beautiful family, an extremely healthy baby, all things considered, a really healthy pregnancy. I just couldn't see a way out of the situation that I was in. I was so tired. I didn't have that great of a sleeper. I was working so much. I had probably 30 minutes with her a day. Everything about just like the career that I was in, the life that I was living, moving from a new city with a newborn, it just felt like I was drowning and I couldn't see a way out of it. And I was so scared to tell my husband that that was sort of like the internal thoughts that I was having, because I didn't want anyone to be afraid for me. I didn't want him to be afraid to leave me with my baby. So there was so much like shame and guilt I felt around having those sort of intrusive thoughts. But when I shared with him really how bad it was getting, I was so thankful and I felt such a huge relief. And together we were able to find a therapist for me almost right away. But I just want everyone to know these topics deserve a place where we can share them, and they are so common. And every time I talk about it, someone's like, the same thing has happened to me. Or when you share that you've had a miscarriage, right? Pregnancy loss is so common, but it never has a place to be told. Same with sort of our discussion today, Rebecca. So I just wanted to share that story so people know why this is so important for me. I wish I had someone like you in a webinar like this with my first. So thank you for your time. And I'm just going to start asking you all the questions that people submitted.
Go for it.
Let's do it. Before we talk about all the perinatal mood disorders, can you just sort of share with everyone, like, how prevalent is this? And what are some stats that we need to know? Like, can you just sort of set the stage for us about this discussion?
So it's really common. So what perinatal mood and anxiety disorders encompasses is basically any sort of mood disorder that occurs between conception and 1 year postpartum. Obviously, we know that postpartum lasts longer than a year, it lasts for the rest of your life, but technically, that's kind of the frame. And research shows that between 1 in 4 and 1 in 5 women at some point between conception and the end of the first year postpartum will experience symptoms of a perinatal mood or anxiety disorder. Most common are anxiety and depression. But things like postpartum psychosis, postpartum or perinatal OCD are other common things. Symptoms of bipolar disorder, that kind of stuff is a little less common. Anxiety and depression are the most common ones. And kind of under the umbrella of anxiety, depression are things like extreme irritability, rage, difficulty sleeping, like all of that kind of stuff. What I often tell people is all these routine things that you're screened for as like the standard of care in obstetrics and midwifery are less common than perinatal mood and anxiety disorders. So perinatal mood and anxiety disorders are more common than gestational diabetes, than gestational or postpartum hypertension, preeclampsia, blood pressure issues, then Group B strep, like all these things that I'm sure everyone who's had a baby knows, like you just kind of get checked for routinely, are significantly less common than these mental health challenges during and after pregnancy. And they're not very commonly screened for. Now it's more common that a lot of practices will assess for postpartum mood issues at your 6-week checkup, but it's pretty much never screened for during pregnancy. And mood issues are just as common during pregnancy as postpartum, which is another thing I think people don't really understand. Like there's sort of more knowledge a little bit and awareness, I feel like now, about postpartum mood issues, but mood issues and mental health difficulties during pregnancy have the same prevalence as postpartum. And most providers are not asking about it. And a lot of providers don't have the right information about treatment of mental health issues of pregnant women. I can talk about that too. So these things are quite common. And considering how common they are, they're not that well understood or discussed in the medical settings where most pregnant and postpartum women are receiving care.
So it's infuriating
Yeah.
that these perinatal mood disorders are more common than gestational diabetes, that disgusting drink we are all forced to take to get our blood pressure taken and do all those things. So if that's the case, what are some questions, like if we want to be educated to advocate for ourselves when we go to our doctor's appointments during our pregnancy, and we can talk about post-pregnancy later, but like, what are some questions that we should be asking if we want our doctor to really help us identify if we're experiencing any of these mood disorders like, how do we advocate for ourselves if a lot of practitioners aren't screening for those during the pregnancy?
That's a really good question. And I think it's hard. I think the number one way to do it is for you to initiate and for you to ask. But providers vary in terms of how many resources they're able to give. And I've gone to a lot of conferences and trainings on this where OBs and midwives come and they'll say, like, we know this is common. We've started screening for it, but once people screen positive or they tell us they're having issues, we don't know what to do then. We don't know where to send them. So my big recommendation to everyone is during pregnancy, try to do your research at that time into some mental health resources. So figuring out what your insurance covers in terms of psychotherapy, seeing if there's a mom group or a postpartum support group or a perinatal support group in your area that you can go to in person or virtually. Try to line up a therapist because oftentimes when you're in the thick of it, when you have a newborn, tackling all of these steps of like calling your insurance, figuring out what your coverage is, you know, calling multiple therapists, trying to make an appointment is really overwhelming. So I would try to get it lined up ahead of time. I've included in some of the resources that I sent out before the webinar of
Mhm.
these fact sheets about medication during pregnancy and if you're breastfeeding and the safety of various medications. If you have a doctor who isn't educated about that and you feel like you're struggling and you're considering being on medication, you've talked to someone else who said they were on medication and it helped them, you can bring those fact sheets into your doctor and say, here's the research, here's the literature showing that these are the most safe, you know, medications to take while pregnant. These are the studies on, you know, on their safety and efficacy. I think this would help me.
Okay, and that's a fact sheet that we can send out post webinar that people
Yeah.
can take to their provider. Okay, amazing. Thank you. So, um, I'm looking to the left, just going through our notes so I don't miss anything. The one question I want to ask you too before we talk to like when your baby is earthside, but I just lost my place. Hold on. Okay, are there triggers or increased risk for people to experience a perinatal mood disorder? Like if
There
so, can you share what those are?
So people who have a history of mental health challenges like anxiety, depression, trauma before getting pregnant are at an increased risk. People who have had fertility challenges or undergone IVF are at an increased risk of these things. And people who have a family history, like even if you personally have never experienced mental health challenges, if you have a family history of addiction or mental health issues, you're at an increased risk. You know, there's also research that shows us people who have difficult pregnancies are at so people who have things like hyperemesis or pain or you know, medical issues during pregnancy, and people who experience a traumatic birth or a birth where they felt like they weren't listened to, their autonomy was taken away from them, something happened that was frightening, like, you know, an emergency C-section where they felt really scared, or you know, other things that can cause a traumatic birth, or just feeling like unsupported and alone during birth. Those are all risk factors. And the other big one is people who have a history of trauma, particularly like sexual trauma, are at increased risk. Um, and the way I like to think of this is not that like, oh, you're like tainted in this way and you're doomed to have a bad experience because you have a history of mental health difficulties. I see it more as like a way for people to find like patience and compassion for themselves and to say like, this is a really huge thing to go through, and to sort of honor the sacredness and the enormity of that, and to say, I am someone who has been through a lot, who's faced dark times before, who's had challenges. Like, I'm going to have compassion for myself and take extra care of myself as I go into this big experience, and like really put forethought into how I'm going to care for my mental health through this in the same way that you would think about how to care for your physical health and your body. Um, and that's really my like overarching guidance to people, is to approach this from a place of self-compassion and not fear.
Yeah. it does feel like there's a lot of fear. So thank you for encouraging us to sort of switch that thinking. I'm going to share one thing from someone. Well, first, someone asked if we'll resend the resources that you just mentioned, like that fact sheet and everything. Yes. No one missed that email because it was just an email between Rebecca and I, but post-webinar, you will get that email with everything we've discussed and the resources that Rebecca's sharing. Someone gave us permission to share this story, so I'll just read it out loud and then we can go into post-birth. This mom said, I felt like I was a placeholder parent for my baby. I felt like his real mom would soon come and relieve him from his babysitter. I had a lot of guilt around a traumatic birth and just did not feel bonded. I felt scared that my husband felt more bonded than I did, and that was something, and therefore there was something wrong with me. Thank you for sharing that. Everyone's experience is so different. And if that was your patient, Rebecca, what might you say to them?
Well, first I would tell you that that's actually really normal and it's really common. And again, like the thing that I try to help people understand is growing and giving birth to a baby is a huge deal. It is a momentous thing to go through. Like even if your birth is not traumatic at all and it's like exactly according to plan. But if you do have a traumatic birth, like trauma impacts your brain and your body. Like human beings after a traumatic experience do certain things to protect themselves and to like your survival instincts go into place. And a big thing that a lot of humans do in response to a traumatic experience is dissociate or separate a little bit from reality, and stop kind of integrating and taking in information the same way. It makes a lot of sense to me. And it's actually really adaptive that someone who just went through a traumatic birth would not be like totally open-hearted, blissful, like just, madly in love and bonding with their baby. It's actually something that your brain and your body is doing to protect you. And I would urge someone navigating this to be patient and compassionate with themselves and talk kindly to themselves and say, like, look, you have been through a lot. You have a really long time to be this baby's mother. This baby is brand new to you. You're going to get to know each other. If you're not the one doing the majority of like the big caretaking stuff in the very early days, weeks, even months, it is okay. Like bonding takes time. And some women have this like instant magical, like they put the baby on your chest and you just feel madly in love, but most people don't. And I also feel like something that's really harmful is, I think a lot of narratives about motherhood are harmful.
Yeah.
I think that one in particular, that a good mom means that you enjoy every minute of motherhood, that you feel perfectly bonded to your baby, that you're just like in heaven postpartum. It's a really harmful narrative because it's just completely false.
Yeah.
And it doesn't make space for sort of the nuance and duality of the fact that like the newborn period is hard, it's painful, it's scary, it's brand new, it's exhausting, it can be terrifying, it can be alienating, and that has no bearing on what kind of mother you are or how you're going to feel about motherhood in a few weeks or a few months or a few years. It's a very short period and it's a very stressful period. And that's a very normal reaction to stress and trauma, to disconnect.
Yeah. Well, thank you for sharing that to her and to everyone else that's on the call. There's so much about the motherhood picture that's harmful and on social media. Like when I see women, and this isn't, to knock them, but it's like, how the fuck does your hair look like you just had a blowout and you have your eyelashes on and you have lip gloss on and you're 24 hours postpartum? Like, when I was home 4 days postpartum, I couldn't reach the toilet paper and I had like this massive meltdown. I was hysterical because I was so upset with my body for not being able to move to like reach to get the toilet paper. I'm just like, so I wish I had given myself more compassion because I didn't. I did with my second. I was so much better with my thinking and how I spoke to myself, how I asked for help. So anyway, thank you for that it was a really beautiful response that you just shared. So thank you. Okay, so the baby's here. Can you help us understand what the baby blues are in the timeline for the baby blues? And then my follow-up question will be, if things are lasting longer than X amount of time, when do parents need to start asking for help? Like, is there a timeline, sort of in general, one that you can share with everybody?
So technically, like clinically speaking, the baby blues last about 2 weeks. And the reason why that is that it's just so basically like ubiquitous that within the first 2 weeks of having a baby, you're on an insane emotional roller coaster because of this dramatic hormone drop. I also often tell people that 3 to 5 days postpartum is often kind of the worst part of that, where maybe this is when that had happened, the toilet
Yeah,
paper
I was
story.
like 4 days and I couldn't reach the toilet paper and I was hysterical.
Sometimes people tell me about like a particularly epic meltdown and I ask like, well, what day was it? They're like 4. And so that's why the baby blues is sort of thought of as like those first 2 weeks. But that doesn't mean that like feeling extremely bad in those first 2 weeks is not cause for concern. At any point, if you are feeling like you're having thoughts of harming yourself, of harming the baby, I call these like, and it sounds like maybe this is a little bit what you were experiencing, Sarah, that you shared, of like big escape fantasies. So it's not that like you're making a particular plan to hurt yourself, but you have this, like women will say this to me a lot, like, what would happen if I just kept driving and like never came home, or if I hit the car in front of me, or if like I got into a minor enough car accident that I had to go to the hospital to have a break, but like I was okay. Or if I just like went outside and like didn't know when I was coming back, or those types of things, or if I disappeared. So that type of thinking is serious and cause for concern. Sort of intense anxiety or like OCD symptoms, like anxiety about the baby's safety, bad things happening to the baby, accidentally harming the baby. This stuff is extremely, extremely, extremely common, but that doesn't mean that it's normal necessarily. And what I mean by normal is that it doesn't mean you should just have to deal with it. Even though it's over 80% of new moms experience these like intrusive thoughts. So like, what if I drop the baby? What if I throw the baby down the stairs? What if I like bang the baby's head against the door frame when I'm walking through it? What if I like the baby falls off the changing table? What if the plastic from the bottle gets too hot and it melts and it can, like these sort of intense intrusive thoughts that people have.
What if the sound machine malfunction and lights on fire? Like I have literally thought through every possible scenario, including what is the route I would take to get to my kids' nursery if my house is on fire? Like it is insane.
Yeah, so those are sort of, I would call those intrusive thoughts, like kind of OCD-ish type thoughts. So like I said, those things are really common, but they're not normal. And they should be treated because they can lead to like pretty extreme suffering. They're just really, really miserable. So I think of normal baby blues as mood lability, so like feeling up and down, crying a lot, kind of just feeling a little bit out of control emotionally. But having these escape fantasies, any like suicidal thinking like the baby would be better off without me, I shouldn't be this baby's mom, like that kind of stuff, those are clinically significant symptoms of, a mood or anxiety disorder that need to be treated. Then technically, like outside the 2-week window, like persisting, intense symptoms are, clinically diagnosed as a perinatal mood or anxiety disorder. But again, if they're extreme and they happen within that 2-week window, I would not just dismiss it as the baby blues.
Okay, sounds good. I think one thing that I experienced, like I shared earlier, was just so much shame and guilt for thinking some of those thoughts. And I did not know how to approach my husband, who, despite having just watched me give birth, the most vulnerable moment my whole life, I still couldn't like pull myself to tell him what I was feeling right away. So how do we have these conversations with our partner? Because in some cases, I wonder if other people who are helping you with the baby might notice them before you do. So what advice can you share on having these types of like really hard conversations with your, your support team and your partner?
So one of the most primary recommended things that's helpful to postpartum moms who are experiencing these types of symptoms is non-judgmental sharing. So like exactly what you just did, like just telling someone what's going on. Also, these types of intrusive thoughts, they reduce when you share them, and they sort of like thrive in like shame and secrecy, and they tend to get more obsessive and you tend to get more stuck in them. So I think partners just being educated that, again, this stuff is common, but it's not normal. So saying like, sometimes I think about this, I'm really worried about this, like I'm concerned that this might happen. And for your partner to listen and validate and understand, but not panic, not try to fix it, not necessarily like to take it literally. And this is what I mean by that. Like sometimes I'll tell people, don't get caught in the facts of the statement. So you're afraid that the sound machine's gonna like get too hot and light on fire. You don't get just like, well, that's not really possible. Like, what if we plug in a surge protector? Like, let's do this, let's do that. Like, that's not really helpful typically. It's identifying what the fear is underneath that. So the fear is just, or the feeling underneath. And the feeling underneath is fear. Like, I'm just worried that something out of my control is going to happen. Or I'm worried that something I haven't even thought of and that seems really crazy and bizarre is going to happen. And there's not going to be anything I can do about it. And so it's saying like, it sounds like you're feeling really scared. Like just that is an intervention in itself, and it helps. Like, I'm right here. We're in this together. You know, maybe we should talk to your OB about what's going on. You know, let's talk to a friend. Let's talk to your mom. Let's find you a support group. Or even just like, you can keep talking to me about this. And I think for partners, it's telling the mom, like, I can handle hearing about this and I'm not scared and I'm not gonna like, bring you to the hospital. But like, I'm here. We're going to get through this together. I know this is scary. You're going through a lot. You're tired. And then it's also finding support of like, how can we help you get more sleep? How can we make sure that you're eating properly? How can we make sure that you're not worried about, other things that need to happen around the house, like practical support in addition to emotional support? Sleep deprivation is also part of what makes people start to like have unrealistic, scary thinking. And so really making a plan for how you're going to get more sleep. Are you being hard on yourself about and having unrealistic expectations about I have to do every feeding, or I have to breastfeed perfectly, or the doctor told us we have to triple feed in order to make breastfeeding work out. And so I'm going to do that even though I haven't slept for more than 45 minutes in 2 weeks. Like, that stuff's not sustainable. And so it's finding ways to rest, get support, and have this like non-judgmental sharing.
Yeah, non-judgmental sharing. I love that. I'm gonna make sure I mention that to my husband today, because it doesn't end. I mean, my kids are 4 and 1, and I still struggle. I still, I saw a therapist for 2 years after Zoe. I probably need to see her again, because sometimes they resurface. And my kids are transitioning and Zoe's going to school, and now I have like a whole nother set of intrusive thoughts. But really quick, we only have like 10, 15 minutes left. So if you guys want to share your intrusive thought, type it. No one can see it. I'll read it out loud and get it out of your brain space, like Rebecca just said. If you guys have any questions that you need answered, that you feel like, we just didn't get to, please type them in. Like, share your story if you want. Type it out. Doesn't have to be complete sentences. If there's something you want to share, a question you want to ask, a crazy intrusive thought that you want to write out in a non-judgmental space, now's your chance. And so I just want to make sure everyone knows that you guys can put whatever you are thinking in the question section. No one can see who's asking them except for me. Okay. The crazy thing is, like, when I go to my 6-week appointment postpartum, I don't even know if I was screened. Like, looking back, I'm not sure. She asked, how's the baby latching? And I was like, well, shitty. My nipples are on fire, so can I see a lactation consultant? How's my sleep? Okay, well, I have a newborn. How do you think my sleep is? I don't think she ever asked questions. My first OB did with Amelia, but not my second. It's just there is no plan in place. So again, I don't know what my question is necessarily, other than I feel like we always have, women specifically have to always advocate for themselves, and the fact that we have to advocate for ourselves this big in such a humongous transition is so frustrating.
It is. And like, if that's really common, number one, that you're not screened properly, or like people will tell me they gave me the form and I filled it out and then like they didn't even look at it, or the nurse left it on the counter and forgot about it, or I filled out all the things saying I was struggling and then no one talked to me about it. So again, I think it's calling and like saying like, I am having intense intrusive thoughts. I cannot sleep. Even when the baby's sleeping, like I'm having racing thoughts. I'm panicking about everything. I can't stop cleaning the house. Like I can't calm down. I'm crying all the time. You know, I'm rageful. I'm like screaming at everyone in my house. Like, say these things. If you don't feel like you can do it, bring someone with you to the appointment, your mom, your sister, a friend, anyone, and have them say it.
Yeah.
Write it in the message portal thing to your doctor if that feels easier than saying it in person. And again, I think part of what you need to do, like to make that happen, is know inside yourself that like this is serious and I deserve to be helped. Like this is not the way I should be feeling. This isn't just like part of having a baby. And also there's nothing to be ashamed of. And I think that's the thing that women, I really want to internalize, of like, I do not deserve to be feeling this way. I am entitled to help.
Yeah, thank you. Someone's asking, does postpartum depression and postpartum anxiety go away on its own if you don't treat it?
Sometimes yes, sometimes no. So often it does, like with sort of a, if it's not extremely severe, often it does. So with sort of like improving sleep, having more support, baby getting older and being a little bit less, you know, demanding and intense, you know, caring for nutrition, sort of taking care of yourself and getting further away from the, you know, really difficult newborn days can help. But it really depends on the severity. What I worry about is that when things kind of become, I'm forgetting the word for this, but basically when like the experience becomes traumatic, and then it's not only that you had this postpartum mood disorder, but then the experience of having it and the things that you were telling yourself and sort of the way that you were being forced to live without help became traumatizing. And then you're suffering from the after effects of that trauma rather than just like the simple postpartum mood or anxiety disorder, if that makes sense. So yeah, the answer, I guess, is sometimes. But I think there's risks involved in just sort of saying like, I'm just gonna white knuckle it through, and like once the baby's 1, or once the baby's 6 months, or once the baby's sleep trained, I'll be better. It's also really hard to know that beforehand. Like sometimes in hindsight, you can say like, you know, it just kind of improved, but it's hard to know, you know, at the beginning if that's going to happen.
Yeah. The one thing I just kind of want to share is for those of you that are expecting and that are, you know, or a brand new parent, social media is so damaging. And I think that that's one small way you can sort of try to protect yourself, is really, if the people you're following don't bring you joy and make you just lay there and question your own parenting styles or the way you dress. You know, there's like that video of like a mom that went viral. It's like, here's our outfit of the day and we should take pride in how we look. And then it transitions to a mom that's like stuck with her baby on the couch with like 5-day-old mascara. You know what I mean? They're funny, but I would just encourage people to just like go through who you follow and who you give your time and energy to, and just make sure that that's like one small way you can protect yourself as you're navigating this on your own for yourself. Someone commented, this isn't necessarily a question, but that there's a lot of stigma, to your point, Dr. Allen, that postpartum depression means you're a bad mom or don't love your baby.
It is so completely and utterly unrelated to like how you are as a mom or whether you love your baby. Postpartum mood and anxiety disorders are a hormonal chemical thing. They have existed throughout history and throughout time. They exist in every culture and country in the world, you know, across socioeconomic status, across race, across everything. It's a biological thing that happens. I also happen to think that it's a really normal response to some of the wildly unrealistic and insane expectations we have now of mothers. Like that story you told Sarah about like going back to work at 3 months and putting your baby in full-time care and doing that intense drive and pumping, you know, while you're driving and during the workday. Like aside from having a baby, the expectation and the stress level of living that way is a recipe for developing mental health challenges. And so sometimes like the way I like to normalize this for people is that like your body and your brain are sort of saying like, I cannot do this. I need something to change. I need more support because like that's true and they do, and not because something is wrong with you. And the Postpartum Support International, which is like a big, I sent you a lot of resources from them. They do a lot of amazing work in this area. Their like motto is like you deserve to be well, and with help you will get better. And it's true. Like these things are treatable. They're very treatable. We know how to treat them. It's basically medication support, lifestyle changes, sleep, and nobody deserves to feel this way. And it doesn't mean anything morally, ethically, about you as a mother, you as a person. It's just not related. And oftentimes it comes from so desperately wanting to be the best mother that you can be. That's part of why we think, we don't know this for sure, but that research shows that women who struggle with infertility and IVF are particularly susceptible to these things. There's such high expectations that like, I wanted to so badly, you know, I have to do it perfectly. I have to be amazing. This should be the happiest I've ever been in my life. This is another big thing I tell my patients is like, our feelings are one source of distress, but what I find to be a way bigger source of distress than your feelings is all the cognitions and judgments we have about our feelings. So it's one thing to feel sad, but it causes more suffering than sadness to be like, well, what does it mean that I feel sad, and why do I feel sad, and how do I make this sadness go away, and this means that I'm a bad person, and this means this, and this means that, and all this kind of judgment on yourself. So if you're struggling with this, if you know someone who's struggling with this, it has zero relationship to how you are as a mother. And often it's like kind of part and parcel in reaction to how badly you care and how much of a good mother you want to be and that you are, and how much you love your baby.
Yeah, thank you. Two things. Someone wants to know if we can schedule a Zoom for all the people on the call to just like see each other and talk. So yes, we can talk through that potential. And someone's asking if postpartum depression is more common in like first-time pregnancies, like with their first baby, or does it matter?
So I actually don't know the answer to that. Someone else asked me that recently, and I can look it up, but I'm not totally sure. There is some research that if you've had postpartum before, you're more likely to have it again. But anecdotally, I know a lot of people who had postpartum depression or anxiety with the first baby and didn't have it subsequently. And a lot of that is because they got a lot of psychoeducation. They learned like how to do it differently, how to put more support in place, like how to speak more kindly to themselves, how to change their expectations. So I see that all the time. People just really learned the hard way, like how to do it differently, and they approached their second pregnancy and postpartum with so much more knowledge about how to do it differently. But I can look that up and get back to you, and we can email it out if it's more common in first pregnancies, because I don't know.
Okay, sounds good. Yeah, that was my case. Extreme postpartum depression, anxiety, perinatal dermatitis was like a physical symptom of all the stuff that I was experiencing with my first. And, you know, I had the baby blues, of course, and my hormones were crazy, and I experienced some of that stuff with my second, but nothing like I did with my first. But to your point, I was educated. My husband and I knew what to look for. I signed a release form with my therapist. So in the event that I was experiencing those types of thoughts or depression, that my husband could contact my therapist if I didn't feel like I was in a place to. The nutrition, like, you know, everything was different the second time, which I was, you know, and having a second kid isn't not, it's not a part of everyone's plan, but for me, in a lot of ways, I felt like I had a redo. And I was so thankful to experience, you know, just like joy the first year that I felt like I really missed out on with my first.
I hear a lot of people say that like it can be healing to
Yeah.
do it a different way and to
Mhm.
also just do it again in a way that where you can have more self-compassion and say like, you know, if I don't exclusively breastfeed for an entire year, it's okay. If I like don't feel bonded to the baby at first, it's okay. If I, you know, XYZ, like all these different things that can feel so monumental. And I think part of what's so hard being a first time mom is it's very hard to have perspective and everything feels so permanent and the stakes feel so high. And I
So
think
hard.
once you're a more experienced parent, you realize that like you're going to make mistakes. Things are not going to go according to plan all the time. And like, it's okay. And you can repair and you can recover and you can figure it out and you can problem solve. But as a brand new mom, it is very hard to have that perspective.
Yeah. Well, I think you've given everyone the option to change their thinking and to prepare better, either for their first pregnancy or their second or third. So thank you. We are at time. I'm so grateful for you and everything you shared. And like I mentioned, we will be sending the post-webinar recap email in a couple hours with a link to this recording. There's also a post-webinar survey. If you guys have feedback, please don't hesitate to let us know. You can also reply directly to the email that I'll send in a couple hours. So Dr. Allen, thank you for everything, and I hope you have a great weekend.
Thanks for having me. It was so nice to talk about this with everyone. And I think Sarah has my website and my Instagram and my information. If anyone wants to reach out to me for resources, more information, if you're interested in joining my Hold the Mother groups that I run, I'd love to hear from you.
Yeah, we'll make sure to include all of that for them. Awesome. Thank you.
Thanks. Bye.
Bye.